The main reason I came to Dr. Ben was for diabetes, thyroid disease, and a really debilitating depression. Actually, was the main reason that I was seeking an alternative treatment to the pills and things that people had tried before. I had gone through years of mood swings. People would call mood swings. I had gone through years of, they would try antidepressants, even some, vitamins. Nothing ever really worked. Usually the antidepressants had horrible side effects, and I even went through a serious depression, even suicidal thoughts, and went through about a 6-month period where I just would go to work, come home, go to bed, go to work, go to bed. Now I work, I have a pretty active life. I don't have any depression whatsoever anymore. I don't have any sadness or high-low mood swings. I don't take any pills, I don't take any medications for my diabetes, which is gone. I had pretty serious blood sugar issues for 21 years. And since my last blood check that I had a few months ago, I am considered non-diabetic now. It's been an amazing journey with food, just simply really with food. When I came to Dr. Ben initially, and when I have seen him since here at Veritas, I received more hope that there was a chance that I could feel better. And that is a huge difference. Other doctors, they don't leave you with a lot of hope. There's a lot of people out there that they're just so used to taking the pills that the doctors give them, and they don't ever question it. I said, why don't you think there's a better way? When you're 300 pounds and you're miserable in your own skin, and you're miserable every day, and you're miserable at work, and you're in pain, and you don't have anybody to talk to, and maybe somebody can listen and say, golly, I can do this. Because if I could have done it, anybody can do it. Well, my previous doctors tried me on glucophage and some other metformin and different diabetes pills. They didn't work for me. They made me really sick, and basically I was told to limit my carb intake to so many carbs. Like I could eat whatever I wanted, and as long as I limited my carb intake, I'd be fine. But I wasn't fine. My blood sugars were still 200 to 300 fasting. My A1C was still over a 9. I didn't want to be the person who had their feet or legs amputated from high blood sugar. I didn't want to be the person that lost her eyes, or her eyes were very dim at an early age because of diabetes complications. And now I'm down, my A1C is down to a 5.2. which is a huge difference, and my blood sugar is stabilized without medication and without counting carbs and calories, and it's changed my whole life. The 5 to 15 minutes, hurry up, here's your new diet plan, and come see me if you have any questions, which was great, except that the 5 to 15 minutes visits weren't enough to answer all my questions. And then I came to see Dr. Ben, and he gave me that, I don't know, I think I was in there for over 2 hours visiting. And he just empowers you to search out more information. And he researches everything, and it makes it so much easier. Within weeks, I saw a huge difference in pain, joint pain, and my plantar fasciitis, which was pretty debilitating. I couldn't, after I got off work, I work on my feet 8 hours a day. So after I got off work, it was literally excruciating to get out of the car, to go in the house. And after about 2 weeks, I noticed my feet did not hurt at all. The swelling was down on my feet. And of course, I started losing weight immediately when I went off grains. That's a big problem for me, was any of the grains. I don't do any grains at all anymore. And one of the bonuses, I lost 80 pounds. So from a year ago when I got serious to now, I have lost 80 pounds and I'm in the same size I was when I was 19, which is really strange. I'm still getting used to that. I've been overweight all my adult life, and most of the time I look like I was pregnant because of the inflammation from different foods, that were poisoning me, basically. This isn't a diet. This isn't a 30-day plan or a 60-day plan or whatever to lose weight. This is my lifestyle. I don't choose fast food and junk food and candy bars anymore. I choose foods that nourish my body, nutrient-dense types of foods, and I like them. I didn't ever eat them before, so I didn't know that I liked them. So it's not easy. People, if you're on an easy diet, you want an easy diet, an easy, quick way to lose weight or something, this isn't it. This is a lifestyle choice. You choose health. You have to choose health. And along with it comes the best rewards. Some people say, oh, it doesn't work for everybody, but it does. Everybody that I've talked to that tries it just 1 week, made such a huge difference. My plantar fasciitis, 1 week my plantar fasciitis was gone. And after a year, after several months, the depression was completely gone. And now after a year, my recent lab work show, no diabetes. There's hope. There's hope.